Everyone, warm greetings from Dr. ANURAG Kashyap. After giving peribulbar block, conjunctival flap is fashioned and cautery for bleeders are done. This instrument is Ranjan MSICS marker, originally invented by one of my mentor Dr. Pratyush Ranjan for better control over sclerocorneal tunnel creation. After making the first incision, which is the first plane of sclerocorneal tunnel, the second plane into the cornea is created cautiously, not to prematurely enter the anterior chamber. The sclerocorneal pockets are made, which is well appreciated because of the blood staining of the cornea due to the blood entering the corneal tunnel from the outside. The pockets are being made onto the both nasal and temporal half. Side port is being made 0.5 to 1 millimeter inside the limbus. The anterior capsule is stained using dye and the dye is washed with fluid. We have all seen Dr. Uday making this nice wave with viscoelastic substance for filling up the anterior chamber. I have tried the same. After the first nick with the cystitome, we are using Utrata forceps for capsular access. In the learning phase, we must try and make a smaller capsular access, and the important point should be noted is to hold and grip the capsular access flap near the margin again and again to have better control over the capsular access. But we must learn from our mistakes and not get too confident to avoid any complication. Unlike here in my case where the rhexis margin ran out slightly on the nasal part, rhexis was then enlarged cautiously. Entry is being made with 2.8 mm keratome, and we can appreciate the corneal dimple at the keratome tip when making the third plane of the tunnel. The entry is enlarged. Hydrodissection is tried, but we ended up with hydrodelineation instead, and a bright golden ring is well appreciated. The lens is being prolapsed into the anterior chamber and the posterior capsule is pushed behind using viscoelastic substance. The lens is delivered out using irrigating wire vectors. The remaining cortical matter, mainly the epinuclear plate, is aspirated using irrigation and aspiration Simcoe cannula. For beginners, this step is really important and we must learn so as not to leave behind any residual cortical matter. Complete cleanup is ensured. Foldable intraocular lens is implanted from the side port and is settled into the bag using dialer. Pilocarpine brings down the pupil and it is washed and then side port is hydrated. Thanks for watching.